Bismillah ar-Rahman ar-Rahim. Our case very interesting. This 2-month-old ex preterm 27 weeks, extreme birth weight 700 grams, current weight is 1.7 kg, hypoxic ischemic encephalopathy, pseudobulbar palsy, and all of a sudden the baby having choking attack during the feed. So the baby start to have tachypnea and distressed with decreased air entry bilateral. Impression at that time, this baby having late onset neonatal sepsis, and also reflux leading to the choking attacks and aspiration pneumonia, for which septic workup taken, started antibiotic, and requested for chest x-ray. And this is the chest x-ray after the event or choking attacks it's happened, and this is the x-ray. If we'll see here the x-ray, there is actually homogeneous opacity, patchy opacity is seen in the upper lobe or zone of the right lung with tracheal traction. You see the tracheal tractions in the ipsilateral of the consolidation collapse area, you see, and also the heart also is shifted, the mediastinum is shifted also to the right side at the atelectatic area. And actually there is pneumonic consolidations for follow-up for actually exclusion of the possibility of the lobar collapse. The rest of the chest x-ray is no hilar masses, and also if you see here the patent costophrenic angle both, and heart size in average size, and OGT in the position, OGT in situ or in the positions, and intact bony thoracic cage. So how to differentiate our message from the case, how to differentiate between the consolidation and collapse. This one, if you will actually check it, is consolidation collapse. But how to differentiate between the consolidation, this is pneumonia, and the collapse? By clinical presentation and laboratory assessment or study, and radiological assessment. The clinical presentation, the baby with pneumonia, it will present by fever, cough, tachypnea, choking attack, aspirations, it's due to reflux. If a chest examination, it will be basal crepitations. For collapse, it will be almost same, but it will be low-grade fever. Also, if you will send for laboratory investigation for pneumonia, it will be CRP, it's high, and sometimes the blood culture, it will come positive, and also the indices white blood cell, it will be high. For collapse, it will not actually associated with increased inflammatory marker or any positive microbiology or cultures. This is the laboratory. For radiologically, this is the x-ray, so I cannot differentiate. This is confusion between the consolidation collapse, but if you will do follow-up x-ray, it will come air bronchogram, it will be pneumonia. If persist, it will be collapse. Can I request for CT and chest and pulmonology consultation? Yes. If you are in doubt, or this persists, or the baby is not improved, at that time you can request for CT, chest, or pulmonology consultations. So how to differentiate? Clinically, by the clinical presentation and examination, and the laboratory by inflammatory indices and cultures, and by follow-up x-ray, it will give you hint this is consolidation or collapse. So our message from this case, how to differentiate between consolidations and collapse, the most important, if we see here, this is the right lung or the upper lobe. If you see the lobe here, it will be ossifications of the collapsed lobe, actually non-aerated area. Also, the lung volume is lost, leading to increased ossification. It will confuse you between this is pneumonia or collapse. The second issue is the crowdedness of the blood vessels. Actually, it will increase the ossification also, and shifting fissures, and displacement of the interlobar fissure to area of atalaxis. This is the most reliable sign. As we know, the left, it will be 2 fissures, the right, it will be 3 fissures. It will be displacement of interlobular fissure to area of the collapsed area or atelectatic area. This is the most reliable sign. The second thing, the crowdedness of the blood vessels, and also decreased lung volume lead to increased ossification. This is for the lobe. If we will go for the extra loops, it will see here the hemidiaphragm. Do you see the hemidiaphragm here? Actually it will be elevated, it will be big sign, but actually is not present in this case. If you will see here the hilar shifting or actually distortion, it's normal here. And also if you will see the compensatory, this is the most important issue also, compensatory hyperinflation of the left side. If you will see, even looks like herniation. This is compensatory hyperinflation, compensatory contralateral hyperinflations. And also if you look for the ribs, it will be approximations is near to each others. In the collapse it will be narrow ribs, it will be in the for consolidation it will be normal or hyper inflated. There is obscuring of the structure adjacent to the corresponding lung, like the diaphragm and the heart and the pulmonary vessel. It will be not clear, it's not clear. And the collapsed lobe, the shape of the collapsed lobe can be triangle, or it will be wedge shape, or it will be like pyramids. And the points of the pyramid, it will be pointed, the apex of the pyramids or the triangle is pointed to the hilar, And what is the cause for these deteriorations? It's due to the baby having pseudobulbar boats, cannot swallow the secretions. This is mucus plug blocked the upper loop. And how to treat? It will be treated by CBT or chest physiotherapy and suctioning, and we will put the right side up. So the message from the case, how to differentiate between the consolidation and collapse. The most important thing is this long volume. It will be decreased long volume leading to ossification. Also crowdedness of the blood vessels or bronchopulmonary vessels is leading to ossifications. And the most important, the fissure. The fissure, you call it shifting fissure or displacement of interlobar fissures to area of the atelectasis. This is the most reliable. The other signs, if you will see here, that it will be sometimes it will be the diaphragm, it will be bigged or elevated. And sometimes the most important, the tracheal shift, it will be pulled. In the consolidation it will be pushed, but here is pulled, the trachea is pulled, and the heart also is coming to the ipsilateral area or the same area of the collapse. And also the compensatory mechanism here in the left lung. If you see this is hyperinflation or compensatory hyperinflation, you see some herniation. This is leading and pulling. You see the pull. It goes with collapse. The ribs, it will be approximated to each other, قريبين من بعض. And also the obscuring of the structure adjacent to the collapse is not clear also. It will be not clear. And the collapsing area, it will be triangle shape, and the apex of the triangle, it will be pointed to the hilar. What is the cause? It will be mucus plug in our case. And the treatment, it will be CBT suction and right side up. ومن أحياها فكأنما أحيا الناس جميعا. شكرا، سلام عليكم.